Right, okay, so my first question to you is, how many people in here, you're not in this question, would like to have any vision about going forward and practicing medicine abroad? Okay, right. So this is abroad for me, actually. Well, maybe not after 26 years, and I finally made the jump and got my UK citizenship last year, December. I wonder why. This is the most important message I want you to take home, okay? Yes, you want to do lots of things. We all want to do lots of things, but this really isn't about you. It's about them, okay? Just like it is in your daily life as a doctor, when you qualify, it's not about you, it's about the patient. So this is not to glorify yourself. This is not so that you can say, I did this and look at my pictures and, you know, we went there and here I am, you know, in front of the desert and all sorts of things. So it is about them. There are lots of reasons for why people want to go abroad and practice medicine. You know, is it altruistic? Is it Florence Nightingale? Is it because you're a Superman? And, you know, now we know why he wears his pants on the outside. But there is a cost to the local population, and there is a cost to the local hospital and the doctors and nurses who are in that hospital. So when you come, they have to work twice as hard as they do when you're not there. And when you leave and go home and show your pictures about how you rescued this, that, and the other, then they are there to pick up your complication rates. And without a doubt, we all have complication rates. The only people in medicine who don't have complication rates are pathologists. Okay? That's it. Any surgeon who says they don't have complications is lying. So imagine that other people, that doctors from other countries would come to your hospital and see your patients. We have international speakers who come and give us talks, which is amazing. And we listen to them and we give them patients to operate on them. But imagine then also, you know, selfies. Really? You know, show respect. So the international speaker, the international renowned surgeon who comes and operates in our hospital is carefully selected. We carefully select patients for him or her to operate on. We counsel the patients. We do it with their best intentions. You will do what you are trained to do, and this is what you do first. So for everything, you know, it takes years to go to medical school, doesn't it? You don't kind of turn up and go, I want to be a doctor, and there you are. No, you have to sit down, you have to have a good light, you have to have a good backside, and you have to have good memories. You have to pass lots and lots of exams. And here's the bad news, there are more exams after you finish medical school. Not quite finished. So this is preparation, like everything in life, okay? You don't throw a dinner party for 20 people and then don't cook, yeah? So, how many hours, and this is not me, how many hours do you think that it takes for you from being somebody who can barely spell what it is that you're going to do to become the true expert? Any guesses? Well, it's close, yeah. So we say about 10,000 hours. Okay, so that's over a year, keeping awake every day, doing it 24/7. Okay, so none of us start as the expert. And you know the inversional proportion, that curve that says if you think you know it all, oh gosh, yeah, you probably don't know very much. And if you think you can see all the pitfalls, then you're probably a little bit more safe. But my point is this. You are training yourself at the moment to become the best doctors out there. You're going to be better than the doctors who are in today. You're going to make new things. You're going to do all. But you put energy and you put time into it and you put effort into it. So you need to educate yourself and you need to get those skills. And before you can teach somebody else, you know, you need to be good. Yes? Okay, so there are lots of different things that you can do if you want to help, if you want to go abroad. It doesn't all necessarily have to be about going and cutting people up and sewing them back together again at the end. right? So there are four bigger things, and my colleague here is going to talk about a lot about other things later. Is that right? Yeah. Yes? So this is a sort of a combination talk, I think. So there are lots of things that you can do. So the first thing that many of you are thinking about is service provision. Okay, that is because there is no doctor, so if you are the only doctor there, that's it, they have a doctor. But that doesn't necessarily fit everybody, and you have to have a huge knowledge base, and you need to be comfortable with the decisions you make. You remember Haiti earthquake? Yes? Okay. So I helped getting plastic surgeons, orthopedic surgeons, and anaesthetists out to give a combined orthoplastic way of treating patients. So it wasn't just an orthopedic surgeon came and then a plastic surgeon came, and then, it has to be combined and coordinated. One of my guys, a plastic surgeon, met an A&E registrar who had gone out, and said, I'm going to help here. That's great. They got talking about a case. The case was about the mangled hand. The A&E registrar amputated the hand because he thought that was the right thing to do. Talking to my colleague, who's a consultant plastic surgeon, he said, well, you could have just done this. So it's not just about the patient who is now without a hand. It's also a question about that A&E registrar had any kind of insight. He now has to live with the fact that he's amputated a hand on somebody that could still have a hand. So these are big decisions. These are big decisions for the patients. These are also big decisions for you, which, if you have any insight, and I'm totally convinced that you will have to live with. Okay, so you can give political support, and I don't mean up on the barricades, though I will probably be up there too. You can give economic support. You can give money. There's nothing wrong with if you don't want to go, but you can give your money. You can do an extra shift, I can do an extra private case and donate my money. And you can give educational support. So, BFIRST, the British International Federation for Reconstructive Surgery and Training, wow, what a mouthful, but BFIRST for short, gives educational support. How? Again, preparation, preparation, preparation. Analyze the problem, see where you can do, see what is really important in the local setting. See what the local doctors want, not what you think they want, but what they want. So, as I said, it doesn't all have to be clinical. If you go out as a qualified doctor, you can go out. A lot of places just specify you have to have 2 years of clinical knowledge, and then you can go out. But you may not go out and do the things that you think you're going to do. Okay? You're going to be downgraded to doing other things because you may not be able to function as a doctor there. Does that make sense? So you might be used as a nurse, you might be using for vaccinations, you want to be a surgeon, you're going to be in vaccination programs. There is a physical presence of somebody who can do something. If you want to get involved in political or economical, then there are specific programs that you can enter and get an insight in that. And my dream is that we have a pathway. So if you want to be a plastic surgeon, you get into a plastic surgical program. If you want to be a surgeon who goes abroad, you need to know a lot more and maybe different things than what you need to be a surgeon here or anywhere in the West. So what about going and doing a global surgery program? You can also fundraise. There is nothing that says you don't have to go out and do the cutting yourself. You can fundraise, you can donate money. And you can, first of all, if you want to make, you know the saying about, if you want to make a difference, you know the saying that if you teach a man to fish, they'll take care of the fishing themselves. If you give a man a fish, they're going to just eat it. So, but before you go, you have to educate yourself. You can't educate others unless you know all the answers, well, most of the answers. Yes? So you have to educate yourself. So think about that expert graph and think about what you can contribute. So what do you think happens when you volunteer and go somewhere else? And what happens to the local medical students? You think they get, What is it, positive? Is it negative? Is it a mixture of things?
Probably for their time in training.
Well, yeah. I mean, it's both. It can be greatly positive. It's like getting a friend from abroad and you think, gosh, you know, what do you do in your country? How is it? What do you do? But if you take somebody else's place at the operating table in a country where they need more medical help, that's not fair, is it? Because then you take that educational opportunity from that person. And they're going to stay and become a doctor. So without a doubt, it's amazing to go abroad as a student. And these guys had a whale of a time. And they were useful because there were no other medical students in that hospital. But they were used as nurses, as pediatricians, as phlebotomists, as general dogs, whatever. So you need to focus on what you want to do and what you really are going to be doing. So you all have electives, is that right? Yes? Okay. How many people have chosen a sunny place to take an elective? Oh. Okay. So the rest are staying in rainy, cold climate, is that right? I did my elective here, as in UCL. So the rest of you are going to where?
Australia.
Australia, that's sunny.
Malaysia.
Malaysia? US. Okay. And the rest of you are staying here? Governor Regis?
Anyone? No?
You haven't decided. Okay, fair enough. Okay. But you need to find out. I had a talk recently from a medical student who went out and he helped. And he was in Africa and he helped and did a skin graft and he was very excited about that. But I want you to grow up to be responsible doctors and not take the educational opportunities from the local people. I want you to become experts, and when you are experts, I want you to teach others. So, you are going to educate yourself from now on, and you can start now, you can get involved in lots of different things, but you can gear your training towards going abroad without taking it for granted, without saying, I'm here and I'm going to learn. You do learn. Of course you learn. Every time you go abroad, you learn humility. Okay, you learn how to deal with cases that are very different from the cases that you may see here. And you learn about the infrastructure that makes their educational and health system different than ours. So I waited. I spent my training and my education and waited till I thought I was good enough to go out. So I only went out after I was a consultant. And I went out with somebody who was senior to me who's gone out a lot. So I also had a chance to debrief, and I also had somebody who was watching me to see whether I was doing the right thing. This is all about responsibility. So you're all going to become consultant at some point, and they will come sooner rather than later. But just be responsible. So I'm lucky enough to go to Dhaka, Bangladesh, once a year to train and talk about hand surgeries because they have a lot of electrical injuries. Now, bear in mind that the surgeons there are very, very capable, and they have probably debrided more burns than any surgeon in the UK, certainly including me. But what we try and do, and I am conscious of saying we, which means the local doctors and myself, is analysing the problem, seeing whether we can change a little bit in their treatment of electrical hand burns and give them some function back. So this isn't something that I could have been able to do as a registrar. Or what I could have done as a registrar was help analyse the problem. What I could do as a medical student was come out and help collect data. So there are things that you can do at each level, not necessarily everything has to do with cutting. You know, what are you going to do with a hand like that? I'm scratching my head. So this is a replant, for instance. This is a replanted hand, which was replanted, but nothing moves. So what are you going to do? So the problems that you see may not be your everyday problems, because the everyday problems that they have a lot of, they already deal with. They're good at it. They do 5,000. This is a vascular malformation. I put the slide up because as a medical student, you've heard about vascular malformations. Yes? Okay. So when you look at this child, which I was specifically shown as a, what would I do? The child has been sent to Singapore, where they said we can't help the child. So the local doctors decided to skin graft the vascular malformation, which has unsurprisingly repaired. This is a 12-year-old who has the body of a 5 or 6-year-old. She's pathetic. She is pale. She's panting. So, and I'm sorry if I'm overreaching here. What do you think is happening? Do you think her vascular system is coping with this? No, no. Is there anything about her tummy and her chest that you find that looks a little bit different? In stark contrast with her left arm? Yeah, that's right. Why is that? Well, it's probably malnutrition, a bit of that. No, don't worry. They feed her well. It's not bad. But she's decompensating. Okay, she's decompensating. She has an ADM that what you can see on the right arm. She's 12. She hasn't been able to move that arm since she was 4. She's decompensating, so she has an enlarged heart. She has enlarged liver. You could even I, who don't palpate abdomens very often, sorry to say, have felt her enlarged liver. So she's decompensating. So she's going to probably not stay around for that much longer. But so you are being asked as an expert to give your opinion about a case like that. So you have to think about respecting the local doctors, respecting the family who are there looking at you. What are you going to do? You can't be disrespectful in a country where you have been invited as a guest. Am I making sense here? Yeah. So what I would do, I'm afraid, have to amputate her arm. That is my option. I've got one who deals with AVMs. I don't see any other option. You embolize, amputate. But they don't want that. And before you open your mouth and say what you would like to do, you have to think about it. What would they do? What they have the capacity to do, and what they would accept what to do. So going out is about them. It's not about you. Right. We have a trainee arm of Be First, and they have some core values. So there are lots of things that you can get involved if you want with Be First, and I'll give you the website because I think I'm running out of time. If you want to click yes, if you want to take it down. So please get involved, but please think about what you're going to be when you finish. And there are things that you can do as you go along, but what I really want to have is 10 years time, 15 years time, a lot of consultants will already trained and have global responsibility, ethos to go out, because we are hopefully going to be a global community.